The province is entering the color-coded scale for reopening today. To talk about that and the Hamilton LRT plans and lots more, we are joined by Ontario Premier Doug Ford this morning. Thank you so much for joining us. I see your car has delivered you safely. That's good. It's a crazy morning.
Yeah, was it ever. A lot of snow on the road, Bob. But before we start, they just told me you're celebrating your 20th anniversary on this show. So congratulations. The last 20 years on anything, not to mention the media or in politics. That's a big accomplishment.
Well, thank you
so
very
congratulations. And my friend Randy Rath, he's a great guy. 40 years he's been with the company. So you guys are doing something.
He doesn't look that old.
So congratulations. No, he doesn't. He's a great guy. I absolutely
love
Randy.
him. Yeah. Well, listen, thanks so much for carving out some time for us this morning. Can I start with a viewer question here?
Thank you.
We're going to head to Niagara. A viewer wants to know how you are going to ensure that vaccines do not get diverted from Niagara region, and do we know where and why they were diverted in the first place?
Well, what I do is we rely on the health table along with General Hillier and his whole team to determine where the hot areas are, where they're needed most, and they distribute it pretty equally across the region. I understand that everyone wants their vaccine first. The good news is we have all long-term care patients vaccinated, and I believe 65% are on their second doses already. So we're going to make sure we take care of the most vulnerable and people in the vulnerable seniors residents as well. And then over the next couple of weeks, we're going to transition into 80 years of age and older.
How will they find out for those groups? Will they find out from their doctor? How does that process work for those 80 and older, for example?
Great question, Bob. So we have a call center set up, and we're going to be making phone calls. Plus, we're going to set up a portal. And the reason we're setting up a portal for the people over 80, not everyone uses computer or internet. A lot do, actually, but not all of them. So maybe their loved ones, their grandchildren, their children will be able to sign them up, or they'll be getting a phone call. But there's over 600,000 people over 80, and when they told me that number, I thought, boy, that's pretty good news. That's a big population, so people are living a lot longer, and they're a lot healthier than I guess in past years. But that's who we're going to focus on, making sure we take care of the most elderly and the most vulnerable.
Yeah, kind of frustrating this morning with many regions in various colored categories reopening for business, and then this snowstorm hits. But in Niagara, there's big concern because Niagara's in the gray lockdown zone. And is there any timeline there? I mean, the temperature is certainly high. People are frustrated, and there was the threats against Dr. Hergy, which were quite upsetting.
Yeah, it is. That's just uncalled for. And the vast majority of the people would never think of threatening the local medical officer. I know the police are looking into it, but that's unacceptable. From day one, we've all been in this together. Everyone's pitched in, and I know a lot of business owners, they want to open their doors. They're in gray lockdown. Good news is Hamilton's in red, so they're going to be able to open up very cautiously. And I always say, Bob, that this isn't a reopening. This is a transition into the framework, and we're going to be super cautious to make sure everyone opens up safely. That's our number one priority. And for the people in Niagara, I understand. Let's all work together. Let's get the numbers down to the red zone, and we'll be able to start opening up very cautiously and slowly.
Can you give us any idea on timeline?
Well, again, I'll rely on the chief medical officer and the local medical officer. They'll communicate the time frame, and we'll be looking at the positivity rates, the overall numbers. And I'm just, again, the people in Niagara, you're doing great. Let's just keep focusing and bringing these numbers down. And then hopefully in the next couple of weeks, we'll be able to look at it, or a week. I can't give you the exact date. Numbers fluctuate. But our goal is to make sure that you at least get into the red zone. But we all need to work together. I always say, no matter what the municipal government does, or the provincial or the federal government, we can't do it without the great people of Ontario, and everyone's really pitched in, and they've done a great job.
There's a big desire, of course, to get the economy moving again, but is there concerned about perhaps jumping the gun here, with the variants that are out there and the latest modeling that we have seen?
Yeah, I'm really concerned. I saw the modeling, talking to Dr. Brown, and the real hot zones are Toronto and Peel and York that are going to continue on the lockdown until February 22nd, and then it's going to be up to the local medical officers and the chief medical officer to make that decision if they come out of lockdown and move forward. But we have to be very, very cautious, move very slowly, and keep an eye on everything. We live in such a massive province. I always say it's larger than Texas and California in a geographical area. And also, we have 15 million people. So what's good for Kenora isn't always good for, let's say, Hamilton or Niagara. That's different than Toronto and Peel. So we have to make sure that we keep an eye right across the province in all 34 areas.
Okay, before we run out of time, we got to talk LRT funding. So there's been a renewed commitment from the province for $1 billion, but federal money is needed as well, to the tune of $1.5 billion.
Right.
Is there coordination there, and what are the prospects here? It's a priority project now, correct?
It is. Right from day one, Bob, when I got elected, even before I got elected, I said Hamilton's getting $1 billion, and that's a big ticket. And I've never wavered from that. I just want the federal government to support folks in Hamilton like we are, and I'm confident they are. I know the discussions are taking place between our infrastructure minister and the feds, so hopefully the feds will come to the table, and we need to get things moving in Hamilton. And I know the people are great. They want this, and we're going to proceed based on the funding through the federal government.
Okay, we will watch that, of course, very closely. We appreciate your time this morning, Ontario Premier Doug Ford.
Thank you so much, Bob. I appreciate everything you're doing as well. Thank you.